This is a very interesting talk from Diabetes WA, and we've got Kathryn and Diane. So Kathryn is the Aboriginal Health Coordinator, and Diane is the accredited practicing dietitian and diabetes educator working with Diabetes WA. And they'll tell us about their approach in regards to preventing, managing type 2 diabetes and related complications such as vision loss.
Let's see if I can make it work. Just that one? Yeah, perfect. Can you hear me okay? Aren't we lucky to be just before lunch? So I hope you can bear with us a little bit longer. Thank you for having us. Let me see if I can. Did you say it was just that? Yeah, lovely. All right. Just before I start, I'd like to acknowledge the Whadjuk people as the traditional owners of the land at which we're meeting on today and pay my respects to elders past and present. As an organisation, I guess Diabetes WA, we also understand the impact diabetes has on Aboriginal people. And so we've actually made a promise to walk with Aboriginal people and in a respectful way to actually find a solution in reducing the impact of diabetes on Aboriginal people. Diabetes WA, we aim to provide consumers with high quality consumer centre care and support and equitable access to services regardless of their location. Big challenge for us. We have a big state. Our mission is to transform the lives of all people who live with and are at risk of diabetes, and we provide the essential support and education and services to allow people affected by diabetes to live a full and healthy life. Now a little bit about me, just to set the scene, but to tell you a little bit about me, I'm a Perth girl. I was born and bred here in Perth, south of the river, and there I've stayed, and I shall not be moving from the south. I'm married to a chap that's from Zimbabwe, and there you can see we've got two lovely children. We had children quite late in life, so I've still got kids in primary school, and the other one's just hit high school. So a little bit about me, and quite passionate. I've worked in diabetes for a long time, passionate about diabetes and certainly the impact it has on eye health, and we'll talk a lot more about that as we go forward. I'm going to Kathy will introduce herself later, so I'll let her do that. A little bit about our presentation today. Our presentation, we're going to present today the Diabetes Education and Self-Management Yarning Program, and you'll hear us refer to this as called DESI. The program is aimed at people with type 2 diabetes and their families. It was co-designed with community, for community, and to be delivered by Aboriginal health workers in community. So today we're going to share with you a little bit about how the program came about, what it's based on, the principles and the philosophy behind the program. We'll share with you the design process that we went about, and then we're also going to share with you some of the resources and activities, some of that practical stuff of how we actually deliver the program with people in community, and we'll pick up on their eye health and how we get them to, how we support those people on the ground to manage their diabetes and look after their eye health as well. If you've ever sat down with someone with a chronic disease and asked them a little bit about that and how they feel about their chronic disease, like diabetes, for example, or how they manage their eye health, you often hear it's not straightforward. Diabetes or the chronic disease is just one part of their health, and there are so many other things going on in their life. And for you guys, you might actually be able to relate to this picture yourselves even, about health is just one aspect of their lives. So when we're looking at education and how we support people on the ground, we're really considering how we can support people for their whole lives, and we're looking at a holistic approach. So the program we're talking about is a self-management program. It's about empowering people, giving them the skills and knowledge to manage their own health. As we said, people are living with this condition. There's so many other aspects in their life that impact on their conditions. So how do we support them and to be able to self-manage? So it's about that person-centred care, meeting people at where they're at and looking at what impacts on their lives. And I guess traditionally, education or health education, you might know yourselves, hasn't necessarily taken that holistic approach. If you think about maybe how you were educated as practitioners yourselves, what sort of style you were educated in, was that a person-centred approach? Did people come to you and ask you about what knowledge you already had, what skills you had, what your thoughts were about the topic you were being educated, or did they just tell you? And did they take into account all the other aspects of your life? I don't know, maybe. So when we're thinking about educating people out in communities, we start to look at that self-management, that person-centred. How do we meet them where they're at? So the DESI program is actually based on this philosophy, this belief or set of principles, I guess, around self-management. And you can see up there, we said people are ultimately responsible for their own self-management. People wanted to maximise their quality of life. The barriers to self-management are actually in the person's world, not in our world. And the consequences of diabetes are experienced by the person with diabetes. So this philosophy was something that we all spoke about and made a commitment to, that we recognise the person living with diabetes, all of these things impact on them, and that's their belief system. It's not about us. Let's go back one. The other thing the program is actually based about is around adult learning theories. So when we're looking at educating people, we're talking about their health beliefs. So we really start to pick up on what are their beliefs about their own health condition. We look at a step-by-step approach when we're educating people. We're not just giving them all the information at once. We're really working with them, and they're guiding the steps. They're guiding how fast we give people information. So we take it at their stage, their level and their steps. And it's also about giving people an opportunity to share their ideas. Because as practitioners, we might have lots of information. We've got lots of health information. Certainly when it comes to eye health, we know what they should be doing. We know what screening they should be doing. But it's about working with the person and getting their ideas of what they believe is important to them. Maybe eye health isn't their priority at this point in time. And that's really important that we pick up on that and find out where people are at and meet them where they're at. Behaviours or how we actually deliver our education is also really important. And so when we're working in this diabetes education self-management yarning program, we're really using this person-centred approach. We're working with the clients and letting them drive the conversations. It's really coming from them, not about us. So the success of our education lies not only in the content that we're giving people, it's also critical in how we actually deliver this information. And you can probably relate that to yourselves when you're dealing with your own clients. It's not just about education. We can give people lots of information and lots of education, but they don't necessarily put it into practice. And that's probably because we're not working in a person-centred approach. I don't know. Okay, again, get you to reflect on your own education and think about how do you deliver your education at the moment. Is it person-centred? So in summary, the Diabetes Education Self-Management Yarning Program is person-centred. It's a collaborative process between us as health practitioners and the people in the community, and incorporates all the participants' experiences, their beliefs, their learnings, their concerns, and it's a two-way process. It's about sharing information, and you'll see that play out. I've put this slide up because it's important to recognise that there is some tension when we do go out and we're training up Aboriginal health practitioners in the fields, in the community. They're not necessarily being trained in this way themselves, and for them to be able to also deliver in this way is not necessarily, may not be the most comfortable either. So there can be a little bit of tension. You may again think of yourselves or your health practitioners that you're working with. Have they been given the instructions to give people information? Here's your pamphlet, you must do this, you must go see the doctor, you must go see the nurse? Or are they given, told to work with their clients and given the time to work with their clients in a person-centred way? That's the other thing. I'm now going to pass over to Kathy, and she's going to share her experiences and tell you a bit more. It's just the green one. Unfortunately, you can't see it.
Thank you. Hi everyone. My name is Kathy Huet. I'm from Queensland. My mob is Gungaloo and Burrada. I've been in WA for over 10 years and have worked in an AMS in the Kimberleys and currently working for Diabetes WA as an Aboriginal health practitioner. I'm very passionate about working alongside my mob and supporting them on their diabetes journey, and that's why I'm currently studying to become a credentialed diabetes educator, which I shall complete at the end of the year. So, yeah. Thank you. So Di has just talked about the principles and philosophies that underpin the Desmond program. Desmond stands for Diabetes Education and Self-Management in Ongoing and Newly Diagnosed, and is an education program designed to support people with type 2 diabetes. I'm now going to take you on our DESI journey, which is our culturally adapted Desmond program. DESI stands for Diabetes Education and Self-Management Yarning. The co-design process. We started a trial with the original program to get as much feedback as possible. The program was presented as a full day, so from 9 o'clock till 4 p.m. We informed every group that as we go along, we wanted to know their thoughts and ideas. Yarning sessions afterwards to really discuss their opinions on Desmond. This co-creation took place at many sites throughout WA, from up in the Kimberley, Pilbara, Central Desert, Southwest and Metro areas. A lot of time was spent listening to the community around what they thought of the program as it was, and then for how they would like to be, including all the images. All participants were aware that the program had not been adapted and were asked to provide feedback at the end of the session. This was to an external person, not to the facilitators. This slide shows a few adaptations comparing Desmond to DESI. You can see that instead of using a lot of words, we use pictures as suggested by the communities. Feedback from the communities was that for many participants, particularly in remote areas, English was their second or third language, and that generally visual tools would work better. And we use these analogies, example, rusty locks instead of insulin resistance, and the insulin works like a key that opens the rusty locks. And this is to help explain the type 2 diabetes. Oh, there we go. DESI is delivered over 2 consecutive days instead of 1 full day. This slide shows some other ways that the Desmond program was adapted into DESI. So we had the DESI, the Magnet Man, this type of resource size and colour, more appropriate food models, adapted health profile, action plan and participant booklet. And we've got some participant booklets there too, so you can have a look if you want to compare how it was changed. So. Diabetes WA go through Aboriginal health staff in the community where possible, or a health professional who has a respect and connection within that community to bring in the clients. We also encourage the Aboriginal staff to stay throughout the workshops and provide support if needed. There is also support from the Aboriginal Medical Services to provide transport for the clients to attend the program. We work within the community and have that contact person on the ground to help with better attendance and provide a culturally safe environment. Okay. The cultural implementation pathway. To do that, we have the cultural safety pathway, a series of checklists that we can use to ensure that a program is just right for a particular community. Community consultation, so we make contact with community members and or their local health workers to make sure they are keen for the program in their community. Cultural safety, community beliefs or history that facilitators would need to be aware of in order to be culturally sensitive when running the program, for example, like sorry time, funerals, practical considerations, local law and language, good or bad days, separate groups, so men in one group, women in another group. Program content, so go through the sessions and see if anything might need to be changed to meet the needs of the community. Continuous improvement. We record feedback to be used when revisiting community and to help overall continuous improvement of the program. By implementing this cultural safety pathway before we take the program into a community, we can make sure that the program is useful to community, respectful of their needs and culture, and takes into account local law, language, foods, etc., and is run in a way that the community wants and the needs. So we listen to the community. What do the community want? We will do it that way. So, yeah. There we go. So the photo on the left, that's in their newly trained DESI facilitators. So this was taken in Kununurra, and they were delivering to community. So that was using the Magnet Man, and that tells a story, the glucose story of what happens when you eat food, carbohydrates, how it's all processed through your body, and what happens to that food. So and then it goes into what happens when you have type 2 diabetes, where it goes wrong. And photo 2, the one on the right, that's myself delivering in Manjimup. So we go all over the state. So Kununurra down to Albany. So lots of places. So we had a lot of participant feedback, and as you can see, some there. So I'll just read out one of them. You can have a read if you like. So it was great yarning, no pressure, culturally appropriate, definitely made for Aboriginal people, and made sure we made sense of the program. So, and the one I've delivered down in Manjimup, there's been a guy, he's been about 3 times now, and he said every time he's come back, he's learned something new, so, which is really good. Now I'm just going to run this little video of the lovely Nadine. Oh, there's no sound. I don't even know what that is. We've got a technical person here. Sorry. Can we go back?
We can talk to that. Huh? While you went into the video, I guess we can share with you just practically what it actually looks like.
Oh, there we go.
Hi, my name's Nadine Foley. I'm a mum in the local Wadjat community and just a community member. I was very happy to be part of the DESI program for type 2 diabetes, where a group of us gathered in the local community centre, and we were, learning some useful tools not only for my own health, but for my grandmother who attended, who currently has type 2 diabetes. I'm an Aboriginal woman, so I know the stats are stacked against me with diabetes, so it was very important for me to attend and to gain some information and resources and some tools that I can actually put into practice in my own life, everyday life at home with my kids, and what I'm choosing to bring into the home and how I'm preparing stuff. I guess I took away from that session the visuals. I'm a visual learner, and I really appreciated knowing that there's a black fella up there that has, that looks like me, and I got to learn how the body operates in a visual way instead of just words written down on a piece of paper. That helped me put things into perspective. So it really catered for my needs in that area. The facilitator was good because, you can relate to her being in the community and sharing her own stories and thoughts around such an important topic. So she actually empowered us, not just myself, but my grandmother, who had more questions. And she's been to a lot of diabetes courses and different little programs, but she took a lot away from this session. It was done a little bit differently, so I appreciated that because we can put that into practice and make sure that she's got better quality of health as she lives with type 2 diabetes, and also to help me to prevent it, and to use those tools like the felt man that was there was really deadly. So just want to say thank you to WA Diabetes for giving us that opportunity, and I hope that more of this stuff is out there in the community for our mob to learn so that we can have better health. Thank you.
Okay. Thank you for listening to me. I'll hand it over to Diane now. Thank you.
You can share with me. So the last bit, we just wanted to show you practically what it looks like. So we've talked a lot about diabetes, but again, a large focus of the program is on the long-term effects of diabetes, so getting people to recognise those, and then how they might self-manage those long-term effects. Obviously, eye health and diabetic retinopathy is something we talk a lot about in the program. So you can see up there, just to give you an idea, we actually asked people very early on in the program about their thoughts. Remember I was saying about their thoughts, their beliefs about what they think are the long-term effects of diabetes, and we actually captured them right at the beginning. And you can see very pictorial, there's some pictures up there. So somebody may bring up eye health, they may bring up retinopathy, or they may not. But we'll try and draw out the knowledge they already know. They may talk about heart disease, they might talk about kidney disease, whatever comes up. And then we build on that throughout the day. So we first capture their beliefs, and then we'll start to build on it. And we'll show you how we do that in the next bit, where, like Kathy was saying, we use some of those props. That there's a magnet man that we talk about what's going on inside their body in terms of diabetes, and we'll start to relate that back into their eye health, for example. We'll talk about the impacts of high glucose levels on their blood vessels. We'll talk about blood pressure. We'll talk about what's happening in the back of the eye. And it may be we'll draw actually a picture of the eye. And I've seen people do it in different ways to explain it. We use lots of analogies. So depending on whereabouts in the state we might be, some people might be talking about hose pipes in terms of the blood building, or the pressure building up in the hose pipes, and how the hose pipes might burst, and that could create a bleed in the back of the eye, and that's how you might get diabetic retinopathy. Or it might be that we're talking about rivers, and some people have used that as an example where the rivers banks have overflown because there's too much pressure, and you get more streams coming out. So whatever works for that community. So this program really has the opportunity to allow the community and the health workers to adapt it and meet their own needs in a way that makes sense to them. And I think that is the real key for this program. Anything else you want to share, Kathy, from your experiences?
And we also talk about the annual cycle of care, so the 715 health checks, which is all your like your eye, podiatry, your cholesterol, all that as well. So,
And practically, just to finish they do walk away with. So we do them, we use very pictorial, you can see up here. We didn't put it on a slide because this is exactly what we would use. So we use colour-coded charts like this, so people can actually plot their blood pressure, their glucose levels on the chart. They can visually see where it fits in the colour range. We talk about what the red might mean up this end, more complications or more risk of complications, down to the lighter colour, where they want to be. And they can use that very visually. And then they finish up with a plan.
Oh, sorry, wrong one.
That's right. Yeah, no, the Kathy's actually got what they take away, so
Yeah.
they get something to take away. So this is about supporting them to make their own plan. It's not our plan, it's very much what they identify they would like to work on, if anything. And there are some people that may not want to, at this point in time, work on anything. But if they do, they've got the opportunity and we're there to support them, and they can use that and take it to their health professionals. Thank you so much.
And that's it. Thank you.